Welcome to the lecture on intrinsic hand muscles. The muscle belly and tendons of the intrinsic hand muscles originate and insert in the hand. The purpose of intrinsic hand muscles is for fine movement. A motor unit is a motor neuron plus all the muscle fibers it innervates. In the case where a muscle performs fine movement, there is a small innervation ratio. This means each motor neuron will innervate a small number of muscle fibers to enable fine movement. To help you remember motor innervation of the muscles, remember the motor map that we covered in previous lectures. The thenar eminence, also known as the thumb wad, includes three muscles. This is the abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. All the thenar eminence muscles are innervated by the median nerve. Abductor pollicis brevis. Its proximal attachments are the transverse carpal ligament and the scaphoid and trapezium carpal bones. Its distal attachments are the base of the proximal phalanx of digit 1 via the radial sesamoid and the dorsal hood. Abductor pollicis brevis performs abduction, flexion, and opposition at the carpal metacarpal joint of digit 1, flexion at the metacarpal phalangeal joint of digit 1, extension at the interphalangeal joint of digit 1. Its innervation is the median nerve. Flexor pollicis brevis. The proximal attachments of flexor pollicis brevis include the transverse carpal ligament, the trapezium, trapezoid, and capitate carpal bones. Its distal attachment is the base of the proximal phalanx of digit 1 via the radial sesamoid and the extensor hood of digit 1. Flexor pollicis brevis performs flexion, abduction, and opposition at the carpal metacarpal joint of digit 1, flexion at the metacarpal phalangeal joint of digit 1, and extension of the interphalangeal joint of digit 1. Again, its innervation is the median nerve. Opponens pollicis. Opponens pollicis lies deep to the abductor pollicis brevis and flexor pollicis brevis. Its attachments are the transverse carpal ligament, the trapezium carpal bone, and the radial side of the shaft of metacarpal 1. Opponens pollicis performs opposition, flexion, and abduction at the carpal metacarpal joint of digit 1. Its innervation is the median nerve. Take this opportunity to pause the lecture to draw in the three thenar eminence muscles. In blue, write in the attachments and fill in the muscle belly of the flexor pollicis brevis. In red, fill in the attachments and the muscle belly of abductor pollicis brevis. And in green, fill in the muscle of opponens pollicis. How does your drawing compare? The hypothenar eminence is a mirror image of the thenar eminence, only this time it is on the pinky side. The hypothenar eminence is also known as the pinky wad, and all three muscles are innervated by the ulnar nerve. The muscles include the abductor digiti minimi, flexor digiti minimi, and opponens digiti minimi. Abductor digiti minimi, in parentheses manus, means the abductor digiti minimi of the hand, As you will see, there's an abductor digiti minimi in the foot as well. The abductor digiti minimi manus attachments are the pisiform and tendon of the flexor carpi ulnaris, with its distal attachment to the base of the proximal phalanx of digit 5 and the dorsal hood. Abductor digiti minimi manus performs abduction at the metacarpal phalangeal joint of digit 5 and extension at the proximal interphalangeal and distal interphalangeal joints of digit 5. Its innervation is the ulnar nerve. Flexor digiti minimi is also called flexor digiti minimi brevis. Manus is also in parentheses to indicate that we're talking about the flexor digiti minimi in the hand. Its proximal attachments are the hook of the hamate and the transverse carpal ligament. Distal attachment is the base of the proximal phalanx of digit 5. Flexor digiti minimi manus performs flexion and opposition at the carpal metacarpal joint of digit 5, as well as flexion at the metacarpal phalangeal joint of digit 5. Its innervation is the ulnar nerve. Opponens digiti minimi. Its proximal attachments are the hook of the hamate and the transverse carpal ligament. Its distal attachment is the ulnar side of the shaft of metacarpal 5. Opponens digiti minimi performs opposition at the carpal metacarpal joint of digit 5. Its innervation is the ulnar nerve. Note this muscle too lies deep to the abductor digiti minimi and the flexor digiti minimi. Take this opportunity to pause the lecture to draw in the hypothenar eminence muscles. In red, draw in the muscle attachments and the muscle belly of the abductor digiti minimi. In blue, draw in the flexor digiti minimi. And in green, draw in the opponens digiti minimi muscle. How does your drawing compare? Note that the opponens digiti minimi lies deep. The rest of the intrinsic hand muscles are grouped into what are called the mid-palmar muscles. These include the dorsal interossei, the palmar interossei, the lumbricals, abductor pollicis, and palmaris brevis. Note when speaking about the interossei muscles, interosseus means singular, where interossei is plural. Manus, in parentheses, again refers to the muscles in the hand. As you will find, there will be dorsal interossei, palmar interossei, and lumbricals in the foot as well. All the mid-palmar muscles are innervated by the ulnar nerve except lumbrical 1 and lumbrical 2. These muscles are innervated by the median nerve. There's great controversy over whether there are 3 or 4 palmar interossei muscles. For our purposes, we will consider and be consistent with Netter in saying that there are 3 palmar interossei muscles. For naming purposes, a specific number must be chosen for each of the interossei muscles. So when questioned, you must answer based on the 3 muscles and the numbers that we will discuss shortly. Dorsal interossei of the hand. There are 4 bipennate dorsal interossei muscles of the hand. The proximal attachment of the dorsal interossei muscles are the shafts of the adjacent metacarpal bones. The first dorsal interosseous attaches to the metacarpals of 1 and 2. The second dorsal interosseous attaches to metacarpals 2 and 3. The third interosseous muscle attaches to metacarpals 3 and 4. And the fourth osseous muscle attaches to metacarpals 4 and 5. The distal attachment of the dorsal interossei muscles is the base of the proximal phalanges and extensor hoods. The first dorsal interosseous attaches to the base of the proximal phalange and extensor hood of digit 2. The second and third dorsal interossei attaches to the base of the proximal phalange and extensor hood of digit 3. The fourth dorsal interosseous attaches to the base of the proximal phalange and extensor hood of digit 4. All the dorsal interossei muscles are innervated by the ulnar nerve. All 4 dorsal interossei muscles perform flexion and abduction at the metacarpal phalangeal joint. Make sure you understand which muscle or which muscle number moves which metacarpal phalangeal in which direction. For example, the first dorsal interosseous muscle will perform flexion and abduction at the metacarpal phalangeal joint of digit 2. All 4 dorsal interossei muscles will perform extension at the PIP and DIP joints. Again, make sure you know which muscle moves which PIP and DIP. For example, the second dorsal interosseous muscle will perform extension at the PIP and DIP joints of digit 3. The first dorsal interosseous muscle also will perform adduction at the metacarpal joint of digit 1. Go ahead and draw in all 4 dorsal interossei muscles. Please refer to Netter to see how the bipennate muscle bellies work and where their attachments are, and see if you can visualize the movements that the dorsal interossei muscles perform. How does your drawing compare to mine? Note that the dorsal interossei attach to the dorsal hood. This is how they help with PIP and DIP extension. Palmar interossei of the hand. There are 3 unipennate palmar interossei muscles of the hand. Their proximal attachments are the shaft of the metacarpals as follows. The first palmar interosseous attaches to the shaft of metacarpal 2. The second palmar interosseous attaches to the metacarpal, or I should say the shaft of the metacarpal 4. The third palmar interosseous attaches to the shaft of metacarpal 5. The distal attachments of the palmar interossei are the bases of the proximal phalanges and extensor hoods as follows. The first palmar interosseous attaches to the base of the proximal phalange and extensor hood of digit 2. The second palmar interosseous attaches to the base of the proximal phalange and extensor hood of digit 4. The third palmar interosseous attaches to the base of the proximal phalange and extensor hood of digit 5. All three palmar interossei muscles will flex and adduct at the MCP joint. Make sure you know which muscle moves which MCP and in which direction. For example, the first palmar interosseous muscle will flex and adduct the MCP joint of digit 2. Also remember, when speaking about adduction and abduction at the MCP joints in the hand, one must use the functional midline of the hand, which is the third digit. All three palmar interosseous muscles will perform extension at the PIP and DIP joints. Extension occurs through the palmar interossei muscles through the extensor hood. Again, make sure you know which muscle moves which PIP and DIP. The palmar interossei muscles are innervated by the ulnar nerve. Please take this opportunity to pause the lecture, look in Netter, and draw in the muscle bellies and picture how, when the muscles contract, that they would perform the movements that they do. How does your drawing compare? Also note that the palmar interossei attach to the dorsal hood. The lumbricals of the hand. The lumbricals attach to the tendons of flexor digitorum profundus and the radial sides of the extensor hoods of digits 2 through 5 as follows. The first lumbrical attaches to the radial side of the extensor hoods, of the extensor hood of digit 2. The second lumbrical attaches to the radial side of the extensor hood of digit 3. The third lumbrical attaches to the radial side of the extensor hood of digit 4, and the fourth lumbrical attaches to the radial side of the extensor hood of digit 5. The lumbricals receive nerve innervation from the median nerve and the ulnar nerve. The median nerve innervates the first and second lumbricals, whereas the ulnar nerve innervates the third and fourth lumbricals. All four lumbrical muscles perform flexion at the metacarpal phalangeal joint. Make sure that you know which muscle moves which MCP. For example, lumbrical 1 will perform flexion at the MCP of digit 2. The lumbricals also perform extension at the PIP and DIP joints due to their attachment to the extensor hoods. As you will see when you study the lumbricals in Netter, the first and second lumbricals that go to digits 2 and 3 are unipennate. The third and fourth lumbricals that go to digits 4 and 5 are bipennate. Joshi et al. In 2005 dissected 70 cadaver hands. 20% of the first lumbricals and 33% of the second lumbricals had their proximal attachment within the carpal tunnel. Remember that the lumbricals are attached to the tendons of flexor digitorum profundus. These tendons pass through the carpal tunnel. 45% of the second lumbricals they found were bipinnate, and 4% of the hands were lacking a fourth lumbrical. Joshi et al. Had proposed a hypothesis that a proximal attachment of one or more lumbrical muscles may increase the likelihood of developing carpal tunnel syndrome, especially if it involves repetitive finger movements that are required for work or recreation. Take this opportunity to pause the lecture to draw in the lumbrical muscles. Be sure to draw in the tendons of the flexor digitorum profundus as well. How does your drawing compare? In this drawing, the flexor digitorum profundus tendons are drawn in green, whereas the muscle bellies of the lumbricals are drawn in red. Also remember that the lumbricals have an attachment to the dorsal hood. Adductor pollicis. Adductor pollicis lies deep to the first and second lumbricals. It has two heads, a transverse head and an oblique head. Its attachments include the palmar surface of metacarpal 3, the transverse head, the capitate, trapezoid, and trapezium carpal bones for the oblique head, the bases of metacarpals 2 and 3 for the oblique head, and the base of the proximal phalanx of digit 1 via the ulnar sesamoid and the extensor hood of digit 1. The adductor pollicis performs adduction and flexion at the carpal metacarpal joint of digit 1, flexion at the metacarpal phalangeal joint of digit 1, and extension at the interphalangeal joint of digit 1. Its innervation is the ulnar nerve. Take this opportunity to locate the muscle's attachments and draw in the muscle belly. How does your drawing compare? Palmaris brevis. Palmaris brevis is a fairly superficial muscle that lies on the ulnar side of the hand. Its attachments are the medial aspect of the transverse carpal ligament, the medial aspect of the palmar aponeurosis, and the deep surface of the skin on the medial palm. Palmaris brevis's action is to stabilize or tense the skin of the palm, and it may also provide protection to the ulnar nerve. The palmaris brevis is innervated by the ulnar nerve. Take this opportunity to pause the lecture to draw in palmaris brevis. How does your drawing compare?